My name is Joanna Cohn. I'm the director of the Institute for Global Tobacco Control here at the Johns Hopkins Bloomberg School of Public Health, and I'm delighted to welcome you to our monthly Innovations in Tobacco Control seminar series. This is the first time that we're live webcasting, so I'll just ask you all to make sure your phones are turned off, and then we'll get started. So it's my pleasure to introduce our speaker for today, Dr. Emily Brennan. So Emily's currently a postdoctoral fellow in the Center of Excellence in Cancer Communication Research at the Annenberg School for Communications, and that's at the University of Pennsylvania. She's also an honorary research associate at the Cancer Council Victoria in Australia. And that's where she did her doctoral research at the University of Melbourne in Australia. She's been working in tobacco control for over 8 years, and she's done a whole range of tobacco control policy work. So currently, a big chunk of her work is focused on campaigns and communication through media, but she's also done work on secondhand smoke exposure, including in outdoor public places, which is a challenging topic, and looking at, done a lot of work on packs and pack warnings that I expect fed into the policy process in Australia that led to plain and standardized pack adoption in that country. So I think the early reports from the early 2000s, I think, that you were involved in. So that's fantastic. So a lot of her current research is focused on both the development and evaluation of tobacco control communications interventions, including smoking prevention mass media campaigns, as well as graphic warning labels on cigarette packs. So today, Emily will talk to us about her work on campaign themes for youth-focused anti-smoking mass media interventions. So welcome.
Good afternoon, everyone. It's a real pleasure to be here today, and I want to thank Joanna and Kate for the invitation to come and speak, and Melinda for all her excellent logistical organisation. It's been very smooth sailing. So I've met with a few of you already this morning, and I think I'll get to chat with a few more after lunch. And it's been really great to hear so far about all the really interesting and important work that's happening here at the centre. So as Joanna said, I've been a postdoctoral fellow at the Annenberg School for Communication since the beginning of 2012. During my time at Annenberg, I've worked on a few different projects that have all broadly been related to the development and evaluation of tobacco control communication interventions. And this has been building really nicely on the work that I did during my Ph.D. and during my time at the Cancer Council Victoria in Australia. So I'm going to talk about just one of these projects today, in which we've been developing or applying a theory-driven and empirical approach to identify potential themes for some new youth-focused mass media campaigns that are being developed or have been developed by the FDA's Centre for Tobacco Products. And so I've got some screenshots from the new campaign up here, and I'll show you some of the ads later on. However, as I'll try to make clear throughout the presentation, while I'll be talking about a specific application of this approach and presenting some data, my aim more so is to really just introduce you to the approach and to hopefully help you see the ways in which it could be applied across a whole range of settings to inform the development of more effective communication interventions. Okay, so I don't think I need to spend too much time on this, as we all know that despite decades of work to reduce tobacco use, it continues to be the leading cause of preventable premature death and disease. And so it's concerning that every day, more than 80,000 young people around the world become addicted to tobacco, and in the US alone, almost 4,000 young people smoke their first cigarette. We know from a large body of evidence that mass media campaigns, as one component of a comprehensive tobacco control program, can reduce the prevalence of smoking by preventing initiation and by increasing intentions and attempts to quit. And so I've listed here just 3 of the recent reviews that have summarised this evidence. However, it's still very much the case that the effectiveness of campaigns varies quite a lot, and we know that campaign effectiveness is determined by at least 4 important factors, including how much exposure to the campaign there is, what the execution of the campaign messages looks like, what media channels are used, and the focus of today's talk, the specific themes and messages that are used. Now, as I'm sure you all know, in 2009, the US Family Smoking Prevention and Tobacco Control Act granted the Food and Drug Administration the authority to educate the public about the consequences of tobacco use. And the FDA has announced that they will spend $600 million over 5 years on mass media campaigns, and that these campaigns will initially be aimed at preventing smoking initiation. And so the question motivating us in this program of research was what broad themes and specific messages should be used in these new smoking prevention campaigns to ensure that they have the optimal impact on youth smoking behaviour. So I'll note here that this research was funded through a grant from the FDA's Centre for Tobacco Products. The FDA didn't have any input into the approach that we took or into the development of the studies, but this funding situation did mean that we conducted the research with the very deliberate intention of helping the FDA to make more informed decisions about which themes to use in their campaigns. And it also meant that we had the opportunity on several occasions to share our results with the FDA and with the advertising agencies that they're working with. Now, there are a number of different approaches that can be used to decide which themes and specific messages should be used in a behaviour change campaign, including a reliance on the expertise and insight of campaign funders and developers, qualitative research, such as in-depth interviews and focus groups, or the approach that we take, which is the collection of survey data from a large representative sample, which is used to obtain information about the beliefs that are held by the population and the degree to which the population is currently performing or intends to perform the behaviour of interest. So underpinning our approach are traditional theories of behavioural prediction, such as the theory of reasoned action. And so according to these theories, behaviours, like smoking, are causally preceded by intentions to perform the behaviour. And in turn, intentions are causally preceded by beliefs about the behaviour. Therefore, campaigns to reduce smoking behaviour, or anti-tobacco campaigns, should try to change the beliefs that predict having anti-tobacco intentions, which could be defined as either intentions not to smoke or intentions to quit. And so when we're thinking about developing campaigns, the belief to be changed becomes the message strategy or the theme of the campaign. Drawing on this general theoretical approach, we've developed a more specific method for identifying which beliefs should be targeted in a campaign. So in 1999, Bob Hornick and Kimberly Wolf published a paper in Social Marketing Quarterly in which they identified 3 criteria that can be used to identify promising target beliefs. So first, the beliefs should not already be held by too high a proportion of the population, such that there are some people available to be affected by the message. Second, the beliefs should be strongly associated with the targeted intention or behaviour. And furthermore, the beliefs should feasibly be able to be changed by a campaign message. While this third criterion really requires a subjective judgment, criteria 1 and 2 can be assessed using cross-sectional survey data that measures the level of endorsement of beliefs, as well as the strength of associations between beliefs and intentions, which is what we call the intention analysis, and between the beliefs and behaviour, the behaviour analysis. So looking then at these different types of analyses a little more closely, in an intention analysis, survey data assesses the strength of the association between a set of beliefs and the desired behavioural intention. Now, one advantage of this type of analysis is that we're working with the correct causal order. So this means that, theoretically, we expect that currently held beliefs predict future intentions, and that's how we're treating it here. Another advantage is that we're looking at the right people. So we collect data from the group that we want to target with the campaign, and then within this group, we compare those who do and do not have the desired intentions. However, a limitation of this analysis is that intentions don't always turn into behaviour, and so we have an imperfect relationship between what we're measuring and what we're actually trying to change. So complementing this work with intentions is the behaviour analysis, in which we assess the strength of the belief-behaviour association. A strength of this analysis is that we're actually predicting the outcome that we're most interested in, the behaviour. But on the other hand, the causal order is tricky with these analyses. So it's possible that the behaviour caused certain beliefs to change, making us less certain that any observed associations between beliefs and behaviours reflect the influence of beliefs on behaviour and not vice versa. And so then, to make sense of the findings from these two sets of analyses, we use a summary measure that we call the Relative Promise Index, but I'll describe this more in a few minutes when I talk about the methods again. Okay, so another way of thinking about what we're doing here is through this model of how behaviour change campaigns work, which in this incredibly oversimplified diagram is that a campaign changes beliefs, which then leads to changes in behaviour. And so when we think about the elements or characteristics that make an effective campaign, we could think of the audiences that we want to target with the message, the channels through which we want our message to be delivered, the execution of the message, and so on. But we also need to think about exactly which beliefs, if targeted by the campaign, will be most likely to bring about changes in intentions and behaviours. And so I want to make it really clear that this is the one and only piece of this model that we're focusing on in this research, which beliefs should be targeted. Just as a small aside here, I'll note that this approach has so far only been used to guide the development of brand new campaigns, but it's also possible that it could be applied to the selection of existing messages if we wanted to use those messages in a new population, either in their existing form or in a modified form. To the extent that the beliefs being targeted by the existing messages can be clearly categorised, and the strength of association between beliefs and intentions and behavioural outcomes can be assessed in the new population, then the same method that I'm describing today could be used to classify existing messages as being relatively more or less promising for the new audience. And so that's just another potential application of the method to keep in mind. Okay, so moving now into some specifics of how we applied this approach in our work for the FDA. In starting out with this project, we identified 4 different types of campaigns in terms of their target audience and target behaviour that we felt were relevant to the FDA's goal of reducing the prevalence of smoking among youth and young adults. And so this table is going to show you the different age groups, target populations, data sources, and the types of analysis that we conducted for the 4 potential campaigns. So the first campaign we identified has as its goal preventing smoking initiation among 13 to 17-year-old never smokers. The second potential campaign also has preventing initiation as its behavioural goal, but this time the target group is 18 to 25-year-old never smokers. We also identified themes for a campaign aimed at stopping progression to daily smoking among 18 to 25-year-old non-daily smokers. And then the fourth potential campaign has encouraging cessation among 18 to 25-year-old current smokers as its goal. And so I'll now describe the sample and the different outcome measures that we used for each of these campaigns in a little more detail. So first, for the 13 to 17-year-olds, we had a sample of 1,142 non-smokers, and the outcome variable of interest was having no intention to use tobacco over the next year, which was measured using 5 questions, measuring intentions about different tobacco use behaviours. And we required participants to answer that they were very unlikely to perform all 5 behaviours, which 72% of this sample of non-smokers did. And as you can see in the bottom row there, we were only able to conduct an intention analysis for this campaign, as one of the online panel companies we worked with didn't allow us to measure smoking behaviour among the teenagers. For the prevention campaign for 18 to 25-year-olds, we had a sample of just over 1,000 never tobacco users. And in the intention analysis, the outcome of interest was again having no intention to use tobacco, which was the case for 76%. By comparison, in the behaviour analysis, we compared the beliefs of the 337 current tobacco users with the 1049 never tobacco users, with the idea that we're trying to find those beliefs that distinguish those who are currently using tobacco from those who have never used it. Never tobacco users here were defined as those who have never smoked cigarettes and who hadn't used any other tobacco product in the past 30 days. So it's not quite a perfect measure of ever tobacco use. And current tobacco users were those who had used a cigarette or some other tobacco product in the past 30 days and who initiated smoking after the age of 18. And so this age restriction was used to make this group of current users more similar to the target audience for the campaign, which is the 18 to 25-year-old never smokers who, by definition, will have to initiate after the age of 18 if they do so. Looking now at the Stop Progression campaign, for the intention analysis, we had a sample of around 500 non-daily cigarette smokers, and the outcome was having no intention to be smoking every day 1 year from now, and this was held by 33%. For the behaviour analysis, we compared the beliefs of 538 respondents who had used some type of tobacco every day for the past 30 days with 650 non-daily users. For the cessation campaign, we were only able to conduct a behaviour analysis, so we compared the beliefs held by 838 current established smokers, defined as those who had smoked more than 100 cigarettes in their lifetime and had smoked in the past 30 days, with the beliefs held by 101 former established smokers who had smoked more than 100 cigarettes in their lifetime, but not in the past 6 months, and they also hadn't used any other tobacco products in the past 30 days, which was an effort to exclude those who might have transitioned from cigarette smoking to other tobacco products. Okay, so that's the description of the campaign objectives and outcome measures. Now we'll look at how we measured beliefs. So in deciding which beliefs we should measure, we started by conducting a systematic lit review, which was really focused on 3 questions. What factors influence youth smoking? What have previous campaigns done? And what do theories of behavioural prediction have to say? And so unsurprisingly, the type of things that this led us to were beliefs about the positive and negative consequences of tobacco use, beliefs about the descriptive and injunctive norms regarding tobacco use, and self-efficacy to avoid smoking. From this review, we identified 20 potential campaign themes, and then we generated a set of 164 individual beliefs that were thought to represent one of the larger themes, and which would provide the basis for a specific campaign message. All of these individual beliefs were measured using 5-point scales, although for the analysis, responses were dichotomised so that we had the strongest anti-smoking belief versus all others. For each of the 20 themes, we used factor analysis to make sure that the beliefs that were intended to measure that theme were indeed highly related to one another. And then we averaged together the set of beliefs to create a scale. And again, for the analyses, the scale was identified to identify the group of respondents who had the desired anti-smoking response on that set of items. We then separated the 20 themes into 2 groups according to whether we felt they were more or less relevant to the FDA's regulatory authority. And so in doing this, we were really trying to be responsive to the fact that the FDA has been given very specific regulatory powers, which means that in their communication efforts, they're only able to address certain topics. And so from our interpretation of the regulatory authority, we identified 6 themes that we thought had the greatest likelihood of actually forming the basis of an FDA-led campaign, which included beliefs about addiction, about the harmful ingredients in cigarettes, which were measured in 2 different ways, beliefs about the cosmetic effects and the health effects of smoking, and about youth susceptibility to the health effects. And then there were 14 themes that we felt were less relevant. And I should point out that some of these were actually measured in 2 different ways, referring either to the effects of smoking or to the effects of not smoking. So, for example, we had beliefs about the expression of independence, about what would happen if the person smoked, and expression of independence beliefs that refer to the consequences of not smoking. And just a final note here on this slide, we always like to acknowledge that these 2 groups were based only on our interpretation, and we knew that it was possible that the FDA and their campaign agencies would have a different interpretation of which themes they were and weren't able to work with. So once we collected all of this belief and intention and behavioural data, the main metric that we used to assess the potential effectiveness of the different campaign themes and beliefs is called the potential percentage to gain. Now, this can be a little bit tricky to understand, and it took us all a little while to get our heads around it. But the idea behind the potential percentage to gain is that we're trying to find out what would happen to intentions in the population if a campaign was 100% effective at changing beliefs. And so we ask, if the proportion of the sample endorsing the belief increased to 100%, what is the additional proportion of the sample that would be expected to have the desired intention? For the behaviour analysis, the calculation is exactly the same, and so we're still asking if the proportion endorsing the belief increased to 100%, or does the additional proportion who would be expected to have the desired behavioural status. So here's an example to demonstrate how that percentage to gain is calculated. In this example, which is a cross-tabulation of the health effects theme along the top there with the intention variable down the side, we can see that overall 74% of the sample had no intention to use tobacco. But among those who gave the desired response on the belief scale, 82% had no intention to use tobacco. Therefore, if a campaign was 100% effective at moving everyone into the desired response column, then our best guess about what would happen to intentions is that we would get an additional 8% of the population who had no intention to smoke. And so 8% is the potential percentage to gain. In this second example, which is taken from the behaviour analysis, and again for the health effects theme, we see that overall 76% of the sample had the behaviour status of being a never smoker, whereas among those who gave the desired response in the belief scale, 88% were never smokers. And so if the campaign was 100% effective at changing beliefs, then we would estimate that an additional 12% of the sample would be never smokers. Now, even if you're not totally following what this means, the most important thing to know is that it's an estimate of the maximum possible impact of a campaign. So as I said, we're assuming that the campaign would be 100% effective. We realise that this is an unrealistic assumption, and so really these numbers are just most useful in helping us to order and compare the different themes and beliefs, and we don't focus so much on the actual numbers. Okay, so as I've just showed you, we calculated a percentage to gain value for each theme and each individual belief in both the intention and behaviour analysis. But as I mentioned earlier, there are strengths and limitations with both of these analyses, and so we unified the results by standardising the percentage to gain values and then averaging together the standardised values from the two analyses. Then to make the resulting index more accessible, we converted the values to a 0 to 100 scale, which we call the relative promise index. And so it's these values that I'm going to show you now as we move into the results. Okay, I'll present the results a few different ways today, but first we'll look at the 20 potential campaign themes to see how they were ranked on the relative promise index within each of the 4 campaigns separately. So beginning with the prevention campaign for the 13 to 17-year-olds, and so just a little heads up that these are the findings that were most relevant to the first campaign released by the FDA, and so I'll be coming back to these later. But just to start by orienting you to this very small figure, or small fonted figure. Along the bottom there, we have the values on the relative promise index ranging from 0 to 100. And the 2 vertical lines are at 33, which is 1 standard deviation below the mean, and at 67, which is 1 standard deviation above the mean. Then at the top, we have those 6 themes that we identified as being most relevant to the FDA with the little red triangles, and then the remaining 14 themes with the blue diamonds. So then we can see here that of the 6 most relevant themes, cosmetic effects was the most highly ranked, and addiction was the second most highly ranked, and harmful ingredients, health effects, was the least promising. Then of the less relevant themes, we identified 4 that were in the more promising section, including expression of independence, injunctive social norms from peers, social perceptions related to smoking, and mood effects. Now, the campaign to prevent initiation among 18 to 25-year-olds. Physical health effects was the most promising of the 6 relevant themes. And we identified 3 other themes that showed particularly high levels of promise, which again included injunctive social norms from peers, mood effects, and social perceptions related to smoking. Once again, the results for the Stop Progression campaign indicated that the health effects theme was the most promising of the relevant themes, and injunctive social norms from peers and mood effects were again among the most promising overall. However, we think that there just needs to be a note of caution here for some of these less relevant themes when we're using samples of current tobacco users, as for the Stop Progression and the cessation campaign. And so our concern here stems from the fact that we saw that very few respondents actually endorsed these beliefs, as in only around 10%. So this might indicate that their own experiences with tobacco have not involved an experience of these negative consequences. For instance, the injunctive social norms from peers theme is comprised of beliefs about the likelihood that friends or others my age would disapprove of or not accept the respondent smoking. If the respondent who already smokes has not experienced such disapproval, then it's unlikely that a campaign message could convince them that this is likely to be the case. A similar problem could exist for beliefs about the mood consequences of tobacco use, and as I said, to some extent for all 14 of these less relevant themes. Now, we don't think we need to discount these findings entirely, as there's some chance that a campaign could be designed that effectively challenged the real-world experience or even raised awareness of these potential consequences, but we think we need to apply some caution when thinking about these results. And so finally, when looking at the beliefs that distinguish current smokers from former smokers for the cessation campaign, we see that once again the health effects theme was the most promising of the 6 relevant themes, and social perceptions and mood effects were the most promising overall, although again we might want to be a little bit cautious there. Okay, so we've already seen this slide, but this is just to show you that in the next section I'll be using the yellow shading for themes that were around the mean on the relative promise index, green shading for those that were more promising, and red shading for those that were less promising. And then this table really just summarises the same findings presented in those previous 4 figures, but now we're looking across the findings, at the findings across the campaigns. So first, for the 6 most relevant themes for each campaign, we have the value on the relative promise index, and we've used a slightly larger font size there for the highest and lowest number within each campaign. So using this table, the finding that I'm really wanting to draw out is that for 3 of the 4 campaigns, the health effects theme was the most promising of the 6 relevant themes. And for the 13 to 17-year-olds, we also saw that some of the individual beliefs within this theme were also particularly promising, and I'll show you that in a minute. At the other end of the scale, the harmful ingredients health effects theme was the least promising across 3 of the 4 campaigns, and it was also towards the lower end for the cessation campaign. For the 14 less relevant themes, the green shading at the top, in the top row, shows us that the mood effects theme was particularly promising for all 4 campaigns, and the social perception of smoking and injunctive social norms from peers was highly promising for 3 of the 4. Then there's quite a number of themes that were just moderately ranked across all campaigns, and there's less consistency in those that were the least promising. Okay, so we've just seen the results for the theme level analysis. And so these findings are useful for telling the FDA or campaign developers what the broad topic of the campaign should be. But once a broad topic is selected, then there's still a decision to be made about the specific beliefs that will be targeted by the campaign messages. Therefore, we also conducted the same analyses for all 164 of the individual beliefs that we measured by 4 campaigns, and we found that there can be quite a bit of variation in how promising the individual beliefs are. Therefore, when talking to the FDA, we're always really careful to emphasise that once they select a broad theme for a campaign, then they need to look at the results for the individual beliefs within that theme to make sure that they're selecting a promising individual belief. I'm not going to show you the findings from the 164 individual beliefs today, but I will just give you a few examples so that you can see the types of beliefs that we measured and the way in which the percentage to gain value can vary across them. So using data for the Prevent Initiation campaign for 13 to 17-year-olds, here we have percentage to gain values for the 10 individual beliefs that made up the cosmetic effects theme, which was one of the most promising themes for this campaign. So of the 10, we can see that 3 are shaded green, which means that they were ranked in the top quintile of all 164 beliefs. So these were, if I smoke, I will get yellow fingers, I will develop uneven skin colouring, and I will get wrinkles. And so the idea here is that if a campaign was broadly trying to change beliefs about the cosmetic effects of smoking, the most effective specific messages to use would be talking about the fact that smoking causes people to get yellow fingers, to develop uneven skin colouring, and get wrinkles. Now, for the physical health effects theme, there were 31 individual beliefs. We can see here that 8 of these were in the top quintile overall, and these were beliefs about the effects of smoking on sexual and fertility health, the likelihood of developing cancer, losing taste buds, and so on. At the same time, though, there were 5 health effects beliefs that were among the least promising ones that we measured. And so we can see here that the beliefs that if I smoke, I will clog my arteries, I will damage my body, develop heart disease, develop lung cancer, and it's very unlikely that I will be able to deal with physical pain. These may be particularly unlikely to lead to an effective campaign. So these last 2 tables hopefully help to demonstrate the ways in which the promise of a campaign theme can also depend quite a bit on the specific beliefs that are targeted by the messages. Okay. So I want to take just a minute now to highlight some of the strengths that we think this particular approach offers when it comes to choosing campaign themes. So similar to other approaches that use qualitative and quantitative data, one of the strengths is that the target audience provides evidence in support of the potential message strategies. By relying on data from the target audience, we are able to minimise any unintentional biases that may be introduced when campaign planners and funders or researchers otherwise select the target of a campaign. A second strength is that this approach allows promising themes, as well as unpromising or potentially counterproductive themes, to be identified using systematic empirical tests. And a third strength is that the use of survey data from a large and representative sample means that the findings are able to be broadly generalised to the population. And finally, an overriding strength really is that we think that message strategies that are based on empirical findings are likely to lead to higher quality campaigns. With that in mind, we think that there are 2 broad ways in which the set of findings I've presented today could possibly be used to guide the development of anti-tobacco campaigns for youth and young adults. First, a campaign developer might want to select a theme that shows promise across both age groups and all targeted outcomes, with the intention of creating a unified campaign presence, or even using the same message or very similar messages to change all of the different behaviours. If this approach was to be taken, then it seems that among the 6 themes that we identified as being most relevant to the FDA, the health effects and cosmetic effects themes would both be promising options. And looking outside the FDA relevant themes, the mood effects theme, which includes beliefs about the association between smoking and relaxation and feeling less bored, this theme showed a high level of promise across all of the target groups. An alternative approach to using these findings is to create a campaign that uses the most promising theme for the target audience and the target behaviour, being aware that the impact on other groups may be limited. And so by this approach, for the 13 to 17-year-olds, we've seen that the cosmetic effects theme showed the highest level of promise among the 6 relevant themes, and overall, the expression of independence theme was also promising. By comparison, for a campaign aimed at preventing initiation among 18 to 25-year-olds, the health effects theme was the most promising from the 6, and we can see that this theme would also be chosen for campaigns targeting progression and cessation in this age group. And then the third thing to consider when using these findings, of course, is the findings for the individual beliefs within each theme, which must be also carefully considered when constructing a message. Of course, a caveat on all of these findings is that the cross-sectional data we've collected provides evidence of an association between beliefs and intentions and behaviours, but it does not provide evidence that beliefs cause these intentions or that beliefs explain the smoking status of individuals, even though it's this causal effect that is the basis of our assumption that targeting these beliefs with a message will lead to behaviour change. It's also critical that these findings are interpreted with an eye as to which themes and beliefs are likely to lead to a high-quality campaign, by which we mean a campaign that's able to elicit negative emotions, present new information that doesn't conflict with real-world experiences, potentially use narrative-style messages, and possibly a style that's been shown to be successful in previous campaigns. And so as implied by these 2 caveats, we don't believe that these findings are the only thing that a campaign developer should consider as they develop their strategy, but we do think this data can put them in a stronger position than what they would have been in otherwise. And so this leads me to the actual campaign. So the first phase of the FDA's first national smoking prevention campaign launched on the 11th of February. In this initial phase, they're targeting at-risk youth aged 12 to 17, and their stated aim is to educate these youth about the harmful effects of tobacco use in order to reduce initiation rates among those who are open to smoking and to reduce progression to regular use among those who are currently experimenting. And specifically, they've said that they want to reduce the number of 12 to 17-year-old smokers by 300,000 over 3 years. They've released 2 sets of creatives, one of which I would classify as being about the cosmetic effects of smoking, although they prefer to talk about them as being health consequences. And a second set of creatives that focuses on the way in which addiction leads to a loss of control and independence. So I'll show you one of the cosmetic effects ads now. This one's called Your Skin.
What's a pack of smokes cost? Your smooth skin.
See you again.
Smoking causes wrinkles that age you prematurely. What are cigarettes costing you?
Okay. And the second ad, which is from the addiction set, is called Bully.
Cigarettes are bullies. Don't let tobacco control you.
Okay, so looking back at the data that I presented earlier for the 13 to 17-year-olds, we can see that the use of these broad themes, cosmetic effects and loss of control, was certainly supported by our data. And that's also somewhat the case for the specific beliefs that they seem to be going after. I'm certainly not claiming that these concepts came about purely because of our data. I think the campaign agency probably had more of an influence than what we did. But the fact that they're consistent with our data gives us some cause, I guess, to be hopeful about the potential for this campaign to have an impact. Okay, so in closing, I just wanted to tell you about 2 additional pieces of work that our group's engaged in an effort to establish the validity of this particular approach for choosing campaign themes. So I hopefully convinced you early on that there are strong theoretical reasons to expect that a campaign based on a theme that has a higher percentage to gain value is more likely to lead to desirable changes in intentions and behaviour than is a campaign based on a theme with a lower percentage to gain. But the validity of that claim is obviously critical to our confidence that we're providing good advice to campaign planners when we use this method. And so we're currently in the process of trying to test this claim in 2 different ways. First of all, we're using an experimental study in which we're exposing respondents to very basic messages that are based on either a set of promising beliefs or a set of unpromising beliefs. We expect that in both groups, message exposure will cause belief change, but only in the promising belief condition will this belief change be associated with changes in intentions. We've just finished data collection for this study in the past week or so, and so hopefully we'll have positive and consistent results soon. Complementing this, we've been conducting some analyses using longitudinal data that was collected during the evaluation of the Philadelphia anti-smoking campaign that ran in 2011. This campaign aimed to increase the number of smokers who were using help to quit. And so in this analysis, we've examined whether a change in behaviour over time, from not having used help to quit in a recent quit attempt to having used help when measured at follow-up, we're trying to see whether this change in behaviour was predicted by a change in beliefs. And so in this table, we can see that there's some evidence that this was the case. So for example, this is a little bit complicated, but in the first row, we see that among smokers who didn't believe it would be easier to quit if they used help, at both baseline and follow-up, 14.4% of these smokers had used help to quit at follow-up. Whereas among those who moved from not endorsing the belief to endorsing it at follow-up, 22% had used help to quit when measured at follow-up. And that's a significant difference between those two groups. So I appreciate that this is a little tricky to follow, but I guess the main take-out message is that we're working hard to validate the approach that I've described today, and we're beginning to see some evidence that is consistent with the central claims that we're making. So I'll just finish now by thanking the research staff and grad students at Annenberg who contributed in various ways to this project, and in particular Dr. Laura Gibson and Professor Bob Hornick. And I acknowledge the funding support from NCI and from the FDA's Centre for Tobacco Products. And I want to thank you all for being here, and thanks again for the opportunity to speak. Thank you. Okay, yeah, sure. Yeah, sure. Hi.
So I was just wondering, during your formative research, did you find any difference between male and female?
That's sure. So I think the question was whether there were any differences between males and females. And that is a perfect question to ask because I have more slides about that. So, I mean, a big piece of the work that we did was looking for subgroup differences or differences by demographic characteristics. And I wasn't going to include these, but I have the slides ready to go. So for each of the campaigns that we were looking at, and all of the analyses we conducted moderation analyses to see whether the percentage to gain values were different for males and females, for different age breakdowns within the two large age groups, by race and ethnicity, by education level, and by sensation seeking, low or high sensation seeking. So in total, we conducted between 100 and 120 moderation tests per campaign, and which means that we're then quite cautious in interpreting the effects of any differences that we did see. So the way that we talk about the differences that we saw or the results of these analyses is really just by looking at the overall pattern. So for the 13 to 17-year-olds, we found that in the intention analyses, only 7 of 100 moderation tests were significant. And so we don't want to pay too much attention to any single one of those differences, particularly because that was consistent across the other campaigns. And so when we were presenting the results to the FDA and when we're thinking about these results, our message is really, or we feel that the take-out message from these analyses is that on the whole, the evidence suggests that a theme that's promising for one group of people is likely to be promising for most of the groups. I mean, we advise them to look carefully at the moderation results for the themes and the beliefs that they are planning to work with, but generally they should feel confident that it'll be an effective strategy for everyone. So I guess the answer, in summing up, the answer to your question is not really. There weren't many. We looked and there weren't many differences. Yeah, thanks. Hi.
Thank you for sharing the fascinating study.
Thank you.
My question was actually similar, 2 parts. One is I was wondering, do you, in your research, do you find that cultural differences to things like this? I mean, did you find your findings were similar to some things that have been done in other countries where they looked at, especially the most promising and least promising? And also, I was struck particularly by the least promising being things like clogged arteries and lung cancer, which is what is used in a lot of the campaigns. So did you find the difference in age, particularly with older smokers, having more of an impact on those sorts of things?
Okay. So I guess in this particular study, we haven't specifically looked for cultural differeses beyond the moderation analyses that we did with race and ethnicity groups within the US. But this study was restricted to US citizens only. But I would say, we haven't used the method in other cultures or in other countries around the world, so I can't speak to specific differences, I guess, from this, in terms of these results. But I would say more generally that I think particularly for the 18 to 25-year-olds, we saw that the health effects theme was one of the most promising, at least of those 6 most relevant. And I think that the promise of that particular theme is supported by evaluation data of existing mass media campaigns from a lot of countries around the world. Definitely there's a lot of data from Australia where we've had a long history of using mass media campaigns about the health effects of smoking that has supported the effectiveness of those campaigns. Some of those reviews that I cited at the start have all concluded that messages about health effects, messages that elicit negative emotional responses are an effective strategy. And so the fact that that theme came out on top, I think is, I can't speak to whether there would be consistent findings for this belief level analysis in other countries, but in terms of campaigns in other countries, we see that that's a promising strategy. Yeah.
Can I ask a follow-up question? So the lack of effect of clogged arteries, lung cancer,
Yeah.
and so on, do you think that that's associated with how young these respondents are?
Yeah.
Or that that's information that they already know, so it's not new?
Yeah. That's right. Those findings that I showed you for those specific beliefs are for the 13 to 17-year-olds. So they're a younger audience than what we normally see being targeted by those types of messages. And so I think it's probably a combination of those two things. But both for some of those health effects, they're reasonably well known or they've been used in previous campaigns. But also that there could be they could be of lower relevance to a younger audience. That said, in developing lung cancer and clogging the arteries were among the most unpromising in that set, but developing cancer broadly was one of the most promising ones in the health effects theme. So I'm kind of not super clear on kind of what's going on there just yet. Yeah. Hi.
For the longitudinal study, have you decided what the time frame will be for that and how often the follow-up data will be collected?
So actually that longitudinal study that I talked about we're analysing data that's already been collected. And so the longitudinal study was conducted as part of a campaign evaluation. And so the follow-up period was 3 months for participants in that study. That, just as an aside though, the campaign, the FDA campaign that's just been released is also being evaluated, not by our team, but by researchers at RTI International. And they're also conducting a longitudinal study to evaluate the effects of that campaign. And I think they're using an 8-month follow-up period, going back to the same youth. Yeah. Hi.
I have a question about the prevention initiative population. You said that you couldn't get smoking rates from the survey company.
Yeah.
I'm a little curious about that.
Yeah.
But also, if I understood correctly, the sample was a broad representative sample.
Yeah.
One of the things that I sort of struggle with is that we know a lot of the things that tend to predict initiation with respect to certain characteristics, and whether it's more important. One of the strengths of the study is that it was broad and representative, but should we be more focused on studying youth that we know are more at risk?
Mm-hmm. Sorry, I've lost the first part of your question.
Why couldn't you ask them?
Oh, that's right, yeah. So we worked for the 13 to 17-year-old data, we worked with 2 online panel companies, SSI, or Survey Sampling International, and GFK, which is better known as Knowledge Networks. So Knowledge Networks allowed us to measure smoking behaviour. They had no problem with that. But SSI, for legal concerns about asking, underage smokers about their smoking behaviour, wouldn't permit us to include those questions. We battled with them over that and tried our best to convince them to allow us to measure it. But we were unable to. But what we actually did do is, in that SSI sample, we measured their intentions to smoke in the next 30 days, and we treated that as a proxy for their current smoking behaviour. And then using the Knowledge Networks data, where we could measure intentions and behaviour, we validated that that was a really good proxy. Yeah, and so using that 30-day measure, we excluded current smokers from that sample. And then the second part.
I'm asking about, like,
Yes.
if you're using a panel anyway, like,
Yes.
arguably
The-
you could focus in on certain characteristics to frame your research to really try and ascertain what aspects of a campaign may be most relevant for that population that you're guessing are more at risk.
Yeah, sure. Yeah. I mean, and so I guess when we started with the work, as far as we understood, the FDA was going to take a general population approach, and so would be broadly targeting, at least with this first phase of their campaign, broadly targeting 13 to 17-year-olds. I mean, when moving from our results to the other formative research that they did in the development of the campaign, they moved to focusing more on at-risk youth. So they, in all their formative message testing work, and in some of the other formative research that the campaign agency conducted, they were restricting it to those who were currently experimenting or had already started to experiment or who showed some openness to smoking. With the online panel data, I mean, we didn't have enough experimenters in our sample in order to be able to like stratify the analysis in that way. And so I guess we felt we had the most power by keeping it at that general population level. But I think it's a limitation of the analysis that we've conducted, and in thinking about the ways in which our findings have been, have been translated into the campaign. They're actually targeting a slightly different audience with their campaign messages.
I think because we often with youth try and leverage this de-norm sort of idea, and because of sort of certain stratifications on youth that are experimenting, those youth are more likely to feel outside the norm to begin with.
Mm-hmm.
So
Yeah.
I guess that's what I weigh out in my when you get these findings, it might be skewing it a little bit in
Mm-hmm.
a way that's potentially going to find it still might help with prevention, but we maybe didn't need so much help there anyway.
Sure. Yeah, I think that's a fair comment. Hi.
I'm wondering if that difference in the population you sampled by SSRI and GFK, if you were able to look at sort of non-response bias or systematic differences basically between the two data sets, because I'm thinking, if in one, parents in the permission form and kids in the assent form were told we're going to be asking about potentially illegal activities, if you might have gotten some people saying no because of certain, characteristics about them. But in the other sample, you didn't. So did you see differences in beliefs and various things based on your samples comparing the two online panels?
No, we did quite a bit of work when we first got the data to compare the samples in that way, and we generally saw that there was, I guess we were convinced that there was enough consistency between the samples in the data, in the belief and intention and behaviour data, that we felt comfortable to combine them. But I'll just also say that we used exactly the same recruitment strategy and the same consent forms for both of the samples. Which was, we didn't, I guess for the GFK sample, we weren't explicit about the fact that we'd be measuring smoking behaviour. I think in both of the consent forms, we were much more kind of general. We said that we would be asking them about a range of health beliefs and behaviours. And so that was consistent across the samples. Yeah.
So why did you use both firms? Why not just use one and have a bigger?
Yeah. For like frustrating and complicated reasons. I mean, our intention was to use the GFK panel entirely, but participants from GFK are more expensive than they are from SSI, and we were actually also at that time competing with other researchers for access to the GFK panel of 13 to 17-year-olds. So they have a limited number of 13 to 17-year-olds in their panel, and there were other researchers funded under the same granting scheme that were also wanting to survey them. So GFK would only give us a certain number of 13 to 17-year-olds, and we wanted a bigger sample than that. So it was a bit of a compromise. Yeah. Yeah. Hi.
So I think intention could predict the behavior, right? But on your prevention initiation, there are more changes in behavior analysis than the intention one. Why is
Sorry, I'm not. Sorry.
on your slide, the second part, do you mean
Here on this slide.
10% of your test show difference in their
So, I mean, just to make sure that this is clear, this is, on this slide I'm summarising the results of all the moderation analyses that we conducted. So when I have for intention analysis there for prevent initiation for 18 to 25, we conducted 120 tests, which was looking at the relationship between beliefs and intentions by different demographic subgroups. And so 12 of those 120 tests, the moderation effect was significant, whereas for the relationship between beliefs and behaviours, 27 of those 120 moderation tests were significant. So this isn't presenting the results for how the relationship between beliefs and intentions and beliefs and behaviour overall. It's just looking at the significance of the interaction effects. So.
Just have one question. So I guess the last big youth mass media campaign in this country was a truth campaign.
Mm-hmm.
And, you know, that focus was a bit different than what we're seeing with the FDA's
Mm-hmm.
campaign. Is that because we know more about what impacts kids or youth, and we were sort of misguided with that, or has just the culture changed? Can you speak to that?
Sure. I think the main reason for the difference between the Truth campaign and this new strategy is that the FDA is not able to be vilifying the tobacco industry in their campaign messaging. And so we were clear, like right from the start, that there wasn't really any purpose in measuring beliefs about tobacco industry denormalisation or the role that the industry plays in facilitating addiction and marketing to children and things like that. That just wasn't going to be a topic that was used by the FDA. And they were clear about that from the start as well. So I think, I don't think the decision was based on a consideration of the truth messages and how effective they were or were not. It's just like purely political and strategic. Yep.
The theories that you use for this, it was applied to mass media campaigns. Do you think that it can be applied to warning labels as well and be as effective?
I do think the same method can be applied to warning labels. In fact, maybe even more so than for mass media campaigns. And I say that just because when we've been thinking about how we assess whether this method is effective and leads to more effective campaigns, as I tried to show at the start, there's a lot of different things that go into making a mass media campaign or into a television ad. So there's the belief that's being changed or targeted is just one part of that, but there's whether it's an ad that's showing graphic pictures of people with illnesses or a person telling their own story about their experience with smoking. Lots of different execution characteristics that can vary. And so to some extent when we're evaluating campaigns, the belief that's being targeted, can get lost. But I think with warning labels, the message is so much more focused and kind of limited in how much is going into it that we could, potentially be more confident that these findings would lead to differences in the effectiveness of warning labels. Yeah, I think that's a really interesting and totally appropriate application of the method. Yeah.
Curious with the introduction of e-cigarettes, sort of apply to that. I don't know enough about e-cigarettes and its harmful effects, but I was just curious to get your insights about the applicability or something.
Yeah. I don't know that these findings specifically would help us in any way would necessarily help us to think about campaigns addressing e-cigarette use. But I think the same method could be applied to measuring beliefs and intentions about e-cigarette use, definitely. So that's a very promising avenue for a new study, absolutely, yeah. Okay, thank you very much.
Yeah, so just a quick thank you to Emily for a great presentation, and nice to see the methods behind the work and thinking about how it can apply in other areas and in other countries. So thank you very much. And I'll just finally point out that our next lecture is actually in a week from now. Dr. Ruth Malone will be here in this room, Mel? She'll be somewhere else, so you'll get the email. So Ruth Maloon will be talking about the tobacco endgame, so hope to see you then. So thanks very much. Thank you. Wonderful. Wonderful. So I'll just, I don't know if anyone wants to run and speak to you, and then, should I just close this down?
Yeah, that's